Good morning. Today we're going to deal with, again, continue with the skeletal system, and I'm going to deal with joints. So the joints are point of contact. So these joints, the points of contact, they could be between two bones. Like for example here, you can see that there is a joint between two bones. For example, the joint between the humerus and the scapula, the femur and the hip bone, the joints between the phalanges of the fingers, and so on. So these are joints between two bones, or it could be a joint between a cartilage and a bone. We have seen some of these examples, like here, for example, between the costal cartilage and the rib. Remember that ribs anteriorly, they articulate with costal cartilages. So this is an example of a joint between a cartilage and a bone, or it could be a joint between a tooth and a bone. It has a special name called Gomphosis. So this is a joint between the bone and the tooth. Keep in mind that joints, by definition, are points of contact, not necessarily that these joints, they allow movement. So some of them, they allow free movements, some of them allow limited amount of movement, and others are actually immovable joints. They are just a point of contact between two structures. So either between two bones, or between a bone and cartilage, or between a bone and a tooth. The joints are classified according to the structures that are present between the two structures that come together, as this structural classification depends on the presence of a space between the two bones, or between the bone and cartilage, and so on. So the presence of a space. Some of the joints, like synovial joints, they have a space. Other joints, like a fibrous joint here, or a cartilaginous joint here, they do not have space between the articulating surfaces. And then the second point of structural point is the type of connective tissue that holds the bones, or the bone and cartilage together. Sorry. So it could be collagen fibers that are present between the two bones, for example here, and it's called a fibrous joint, or it could be a cartilage that is present between the two bones. Remember here, for example, we have the hip bones, and this is the pubis on one side, the pubis on the other side, and in between them there is a cartilage, and so it's called a cartilaginous joint. Or there is, like in a synovial joint, there is a joint space. Here there is no joint space, but here there is a joint space. You can see the space in yellow, and there are cartilages on the articulating bones, and the area of articulation is surrounded by a capsule, a fibrous tissue capsule, and strengthened by ligaments. So these are the features of a synovial joint that unite the two bones together. So structurally speaking, we can classify the joints whether there's a space or no space. And the second point is the type of connective tissue material between the two articulating surfaces. It could be fibrous tissue, it could be cartilage, or it could be a combination of ligaments, synovial fluid, capsule, and space. So now, more description about fibrous joints. Fibrous joints, they lack a synovial cavity. There is no cavity here. You can see, for example, between the two bones of the skull, flat bones of the skull, these are called sutures, and the tissue between them is a dense connective tissue. It's a fibrous tissue, dense fibrous connective tissue. No movements are present, or a little bit movement. In the adult skull, there is no movement at all between the bones of the skull. But in the newborn, there is some movement allowed in order to, as we mentioned that before, there's some movement allowed between the bones of the skull. They override each other, for example, during birth. But in the adult, there is no movement at all at the sutures. Sutures is a type of fibrous joint that is confined to the skull. We don't call sutures, we don't use the term sutures for fibrous joints elsewhere in the body. It's confined to the skull. Elsewhere in the body, fibrous joints, we have syndesmosis. For example, there is a syndesmosis between the tibia and the fibula, which the two bones are united by fibrous tissue called the interosseous membrane. This was mentioned last time, a membrane between two bones. Same situation between radius and ulna. There is an interosseous membrane. So this is a kind of fibrous tissue, and it is a syndesmosis. Sometimes in some joints, like this joint here, the distal tibiofibular joint, there is a little amount of fibrous tissue, doesn't allow so much movement, and it is a fibrous joint. But sometimes the fibrous tissue is wide and there is a lot of movement taking place in between the two bones. Both of them are called syndesmoses. The other type of fibrous joint is called Gomphosis, and this is restricted. This name is restricted to the joint between the tooth and its socket. So you can see here, these are the sutures for the skull, the syndesmoses, which are slightly movable, and the Gomphosis, which is located between the teeth and the alveolar process. This part of bone is called the alveolar process. There are alveolar processes in the upper jaw, in the maxilla, and alveolar processes in the mandible. And these have sockets, and they allow articulation with the root, peg-shaped root of the tooth. And in between them, there is a fibrous tissue, a very strong fibrous tissue called the periodontal ligament. So the periodontal ligament is present here in the Gomphosis. Usually there is no movement. If there is movement here, then this is pathological. However, like sometimes we can say that there is a microscopic movement that might take place here, and this will give us an idea about the strength of the bite, for example. Or it might give us an idea there is something stuck in between the teeth, so it will cause a little bit movement of the tooth. It's so tiny movement, and that is the importance of this movement. Otherwise, there is no movement at all. If there is a movement in the Gomphosis, then it's a pathological process. The ligament here is called the periodontal membrane, reminding you that this is a type of fibrous joint. So the fibrous joint, we have dense connective tissue in between the articular surfaces. It could be, there is no space. It could be either between the bones of the skull, so they are called sutures. It could be between the bones of the skull and teeth, so they are called Gomphoses. Elsewhere in the body, they are called syndesmoses. The second type of joints, according to the type of material that is present between the articular surfaces, are the cartilaginous joint. Again, there is no cavity in these joints, and they might allow some movement or no movement at all. So an example here, again, is the ribs and the costal cartilage. There is no movement here at all. Another example are the epiphyseal plates. Remember when we mentioned about the growth of bone, we mentioned that there is an epiphyseal cartilage plate which lay down bone and help in the growth and the length of the bone, increase in the length of the bone. So this is again a kind of joint which there is a cartilage in between, but there is no movement at all. And the other type, this cartilage is actually a hyaline cartilage. And here again, in the costal cartilage is hyaline cartilage. But the other type of cartilaginous joints are called symphyses, like the symphysis here, where the cartilage is fibrocartilage. Remember, we mentioned that there are three types of cartilages in the body. There's a hyaline cartilage, which is the most abundant. There's a fibrocartilage, where the collagen fibers that are present in the matrix are abundant. They are thicker and more abundant than the collagen fibers that are present in the hyaline cartilage. And the third type of cartilage is called the elastic cartilage, like the one that is in the auricle or in the epiglottis, where there are elastic fibers in the matrix of the cartilage. So here we have either hyaline cartilage. Here there's hyaline cartilage, and it is called synchondrosis, or it is fibrocartilage, which is called symphysis. This is an example of a symphysis. Of course, the symphysis in general, because the cartilage is fibrocartilage, so it can withstand more stresses. Because it's a fibrocartilage, it can withstand more stresses. So you find them here in the symphysis pubis. It is called the symphysis pubis because this fibrocartilage is present between the pubis, the pubic part of the hip bone. Remember, the hip bone is formed of the ilium, ischium, and pubis. So the pubis on one side articulates with the pubis of the other side. They are a little bit movable. There's a slight mobility taking place. Even in the symphysis pubis, there is slight mobility taking place. This mobility probably increases during pregnancy. But the more mobile type of symphysis is the one that is present between the bodies of the vertebrae, the intervertebral disc. Remember, we mentioned about the intervertebral disc that has a fibrocartilage in the periphery, and in the center there is a nucleus of gelatinous material. These should be made of fibrocartilage because they are always compressed by the body weight, so they should withstand, should be better in withstanding compressions or compressive forces. So these allow more mobility than the symphysis pubis. So these are two examples of symphyses in the body. A symphysis is a kind of cartilaginous joint. So cartilaginous joint are either in the form of symphyses or synchondroses. In a synchondrosis, it's a hyaline cartilage. In a symphysis, it's a fibrocartilage. The other type of joint in the body, which is usually mobile, and it is the most abundant type of joint in the body, are the synovial joint. And in these synovial joints, there is a cavity. Unlike the fibrous, unlike the cartilaginous joint, there is a space, there is a cavity, which separates between the articulating bones. And in addition to that, you can see here the blue structure is a cartilage. Usually it's a hyaline cartilage, covering the articular surfaces of bone. And that was mentioned previously, that this hyaline cartilage reduces friction and acts as a shock absorber between the two bones and reduces the friction in between them. In addition to that, the feature of this joint is the presence of a capsule, a fibrous tissue capsule, and this fibrous tissue capsule has two layers. It has a fibrous membrane and it is lined by a synovial membrane. So the red one is a synovial membrane. You can see here the synovial membrane, it lines the capsule, but it does not extend over the articular cartilage. The articular cartilage is in touch with the other articular cartilage. A synovial membrane has cells that secrete a fluid, which is an oily fluid. It's called the synovial fluid. And this synovial fluid has two important functions. The first function is that it reduces friction. It acts like a lubricant between the articular surfaces. So that's why it's oily. And the second thing is that this fluid, it flushes the cartilage. So the fluid flushes the cartilage and provides nutrients for the cartilage. Remember that the cartilage is avascular, has no nerve supply, has no blood supply. So it depends on its nutrition. It depends on diffusion of nutrients from the nearby bone or like from the nearby synovium. So this synovial fluid, which is constantly secreted and absorbed by the synovial membrane, it flushes the cartilage, supplies nutrients to the cartilage, and at the same time it's oily and reduces friction between the articular surfaces. Again, I repeat that there is a fibrous capsule, and this capsule is in some places, it is thickened, as we will see in some of the examples in a moment. It is thickened to form ligaments. The other special features of the synovial joint is the presence of the ligaments. I have just mentioned that some of these ligaments are, in fact, they are thickenings of the capsule, and they are present outside the capsule. A ligament is a dense, regular connective tissue. And so, for example, here, this is a knee joint, and you can see on either side of the knee there is a ligament. The capsule has been removed, but the thickened part here is an accessory ligament, which is an extracapsular ligament. It's called, for example, here it's called medial collateral ligament. This one is called the lateral or fibular collateral ligament. Ligaments are not necessarily confined to the outside of the joint, but they might be present inside the capsule of the joint. An obvious example of intracapsular ligaments, ligaments that are present inside the joint, are the cruciate ligaments of the knee joint. So we have here anterior cruciate and posterior cruciate ligaments. These are two very strong ligaments. They are called cruciate because they cross each other like a cross. So that's why they are called cruciate. It doesn't mean that these intracapsular ligaments are present in every synovial joint in the body. But like, for example, in the knee joint, there are intracapsular ligaments. But extracapsular ligaments are more common. They are not necessarily present in the knee. They are present in other joints, other synovial joints of the body. Another feature of a synovial joint is the presence of articular disc. Like, for example, here, this joint is between the mandible and the mandibular fossa of the temporal bone. Remember the mandibular fossa of the skull? And so the joint is called temporomandibular joint. And this joint is characterized by the presence of an intra-articular disc, which is made of fibrocartilage. Not all the joints have an intra-articular discs again. Some of the joints, an example is the temporomandibular joint. This disc is present inside the capsule of the joint, and it's attached to the inside of the capsule, and it allows the two bones, if they are incongruent, if they don't fit to each other, it allows the two bones of different shape to fit together tightly. And so therefore it will increase the stability of the joint. Another example of such intra-articular discs is present in the knee joint. You can see here that the bones, like for example the distal end of the femur and the tibia, they don't fit tightly together. So there are these what we call menisci, a meniscus, medial meniscus and a lateral meniscus, which are made of fibrocartilage. They are a kind of articular, intra-articular discs. So the feature that is present in all synovial joints is the joint space and a capsule which is lined by synovial membrane that secretes a synovial fluid. Some other features of synovial joints is that they have intracapsular ligaments, like the cruciate ligaments, which we find them in the knee joint, and some others have articular discs, intra-articular discs. And this disc is in addition to the articular cartilage that covers the surfaces of bone. So these are features, some extra features that might be present in some synovial joints. Another feature here regarding the joints and tendons is the presence of bursae or tendon sheaths. A bursa is like a fluid-filled sac. The fluid is a synovial fluid. So it's like a capsule of the joint filled with synovial fluid, and it might be connected to the joint capsule, to the joint cavity, or might not be connected to the joint cavity. It's like a pillow, easily compressed, and it reduces friction. So either reduces friction between skin and bone or a tendon and bone. Okay, so you can see here, for example, This is the lateral side of the knee joint section, and there is a bursa here which is called suprapatellar bursa. This bursa is continuous with the joint cavity, but yet there are other bursae, like one in front of the patella, it's called the prepatellar bursa, and the other one here, inferior infrapatellar bursa. This one is between tendon and bone. This one is between bone and skin. This one is between tendon and bone. So these do not communicate with the joint capsule. These communicate with the joint capsule. So these are the bursae. They are present in different places in the body. Again, I repeat that they are fluid-filled sacs. Fluid is the synovial fluid, and they might or might not communicate with a joint cavity. The tendon sheaths, these are tube-like sheaths that they wrap the tendons. For example, here, the long tendons of the muscles of the forearm that move the digits, probably we mentioned something about them last time. These tendons, as they reach the wrist region, they are wrapped by this bluish structure here. These are called the tendon sheaths. Again, these sheaths contain synovial fluid, and they reduce friction because the tendon is always moving. And remember here that these tendons, they will pass underneath they will pass within the carpal tunnel, the very crowded carpal tunnel, and so they need something to reduce friction in between them. And these are called tendon sheaths. They are also present around the ankle joint, not only around the wrist joint, but also around the ankle joints. A bursa might be inflamed. So an example here of a bursa that gives rise to a clinical condition called student's elbow is what we call an olecranon bursa. So when it's inflamed, it's called bursitis. This is a bursa which is present between the ulna, between the proximal end of the ulna, it's called the olecranon, and the skin. So if there's continuous friction, continuous rubbing against a hard surface, this will result in inflammation, and this, because it usually happens in students, so the clinical condition is called student's elbow. We don't feel the bursa unless it is inflamed, and so it will be tense and filled with more fluid, inflammatory fluid, and will be painful. Otherwise, we will not feel it. The movements that take place at the joints are different types of movements. Some of the movements are gliding movements, so the bones glide on each other, and usually in this case the articular surfaces of bones are either flat or slightly curved, and this is an example. Like, for example, here is the intertarsal joints, the joints between the tarsal bones. Intercarpal joints, the joint between the carpal bones. Vertebrocostal joints, remember the ribs, they articulate posteriorly. The head of the rib here, the head of the ribs articulate posteriorly with the vertebra, so as the tubercle articulates with the transverse process. These are plane joints. They allow gliding movement to take place. The other type of movement is angular movement. There is angulation taking place in between the bones. So this necessitates that the surfaces of the bones are convex on one side and concave on the other side. So for example, here in the elbow joint, and it's a kind of a joint it's a synovial joint, and it allows a movement like a hinge. So sometimes it's called a hinge variety of synovial joint. And the movement is around a single axis, so it's called a uniaxial joint. Another example of such a uniaxial joint is the knee joint or the ankle joint, or these joints, the interphalangeal joints between the phalanges of the digits or the toes. Usually in hinge joints, like this one, or these examples, the knee, the interphalangeal, the movements are flexion and extension with hyperextension. Flexion is approximation of surfaces or reduction in the angle between the two bones. Extension is increasing the angle in between the bones. And hyperextension is going beyond the anatomical position. For example, this will be flexion of the shoulder joint, and this will be extension of the shoulder, but going beyond is a hyperextension. Okay? So these are examples of the movements that we have in uniaxial hinge joints, like flexion, extension, hyperextension, flexion, extension. Also for the knee. For the knee, flexion is a backward movement, so it's not always a forward movement. Like at the elbow, it's a forward movement, flexion. But flexion of the knee is a backward movement, and the reverse is for extension. So flexion and extension are angular movements that are allowed in uniaxial joints or hinge joints. Also, other types of angular movements are adduction and abduction. And in adduction, it is a movement of the structure or the joint toward the midline. So it's a movement toward the midline. This is adduction of the shoulder, and here is abduction, movement away from the midline. Same thing is true for the hip, but of course in the elbow joint, this movement is not allowed. It's on the elbow, it's only flexion and extension. There is no adduction and abduction. But in the wrist, there is flexion, extension, and at the same time, there is adduction and abduction. Okay, so it is biaxial joint. It's not a single axis, it is a biaxial joint. Again, I repeat that adduction is movement toward the midline, and abduction is a movement away from the midline. In the limbs, like in the digits, in the hand or in the feet, let's take an example of the hand. Usually the midline, the middle finger is regarded as a midline. So movements of the digits away from the middle finger is an abduction. Movements of the digits toward the middle finger is an adduction. The middle finger itself cannot be adducted. It is the axis of adduction. So it can be only abducted. You can move it to the side. Any side it moves is an abduction. Okay? And there is another movement, another rotary movement, which is called rotation. And this is a movement where the bone rotates around its long axis. Usually happens in long bones. So it moves around the bone, like for example here in this example, it is the movement of the humerus around the long axis of humerus. So there's medial rotation, movement toward the medial side, or a lateral rotation, movement toward the lateral side. It is around the longitudinal axis of the bone. So you find that in some joints, like the joint, for example, the shoulder joint, which is a ball and socket joint, there are 3 axes of movement allowed. So there is one axis here for flexion and extension. There is another axis, which is perpendicular to it, for abduction and adduction. And yet there is another vertical axis which allows medial and lateral rotation. So 3 axes here are working for such a joint. The same is true for the hip joint, for example, but of course the range of movement is much more restricted than in the shoulder joint. Another movement, angular movement, is called circumduction. And it's important to differentiate between circumduction and rotation. Circumduction is not a movement by itself. It's a combination of movements. It is, sometimes it's described as if drawing a cone in space. So it's something like that, where you are drawing a cone in space. That's a circumduction. It's a combination of, let's say, let's take the shoulder as an example. So it's a combination of flexion, abduction, extension, and adduction. And then we repeat. So it's not a movement by itself, but it's a combination of these movements. It's called circumduction and not rotation. Rotation is a movement around the longitudinal axis of the bone. So that is medial rotation and lateral rotation, and it is not in any way related to the circumduction. So this is a summary of movements at synovial joints. Gliding, there is no change in the angle. Angular movements could be flexion, extension, hyperextension when you go beyond the anatomical position. Adduction, abduction, circumduction is the combination. And then we have the rotation. And yet there are some special movements which are not present in all the joints in the body. Like here, the special movement that is taking place at the temporomandibular joint, like elevation and depression. So this is a special movement of the temporomandibular joint. Also we have protraction when you move your mandible forwards. That's protraction. And when you take it back to its normal position, it's called retraction. So these movements are confined to the temporomandibular joint. We have the important movement that we mentioned about last time, which is the movement of supination and pronation. This movement takes place in the forearm, whereby the radius rotates around the ulna. So this supination and pronation, such a movement doesn't take place at any other joint in the body, any other place in the body. And in the foot, there is inversion and eversion, as you see there. An inversion, where the sole of the foot faces inwards, and eversion is where the sole of the foot faces outwards. Again, this is only unique movement for the joints of the foot. And there is in the ankle, it is sometimes difficult to say which one is flexion, which one is extension. So that's why they use the term dorsiflexion and plantar flexion. Dorsi and plantar flexion, to differentiate between these movements. These terms are only confined, they are only unique for the ankle joint. Dorsi and plantar flexion. Supination and pronation for the radioulnar joint. Inversion, eversion for the joints of the foot. Now let's take some of the examples of joints in the body and apply our knowledge to these joints. So we have the shoulder joint, or the glenohumeral joint. It's an articulation between the head of the humerus and the glenoid cavity or fossa of the scapula. These were mentioned last time. And you can see here that the cavity is very shallow, and it's about only 1/3 of the head of the humerus that lies within the cavity, which means that there is more flexibility, there is more movement taking place at this joint, but this is on the expense of stability. It is less stable if we compare it with the hip joint. There's a capsule, so there's a fibrous capsule here, and the capsule is attached on one side to the bone, to the glenoid, and to the other side it's attached to a region which is called the anatomical neck of the humerus. The neck is a narrow part of the upper part of the humerus that follows the head, so it's a neck. It's called anatomical because there is another neck here between the proximal end of the humerus and the shaft, which is called the surgical neck. And the surgical neck is called surgical neck because it is the place where the humerus commonly fractures. Not all the time, but it's a place where the humerus commonly fractures. So it's called surgical neck. Anyhow, the capsule is not attached to the surgical neck. It is attached to the anatomical neck of the humerus, and it is thickened by ligaments. And there are bursae. Remember the bursae, which are the like pillows of synovial fluid. So, like for example, here we have a subacromial bursa, which is located below the acromion of the scapula, and this does not communicate with the cavity of the joint. This one, the subscapular bursa, communicates with the cavity of the joint. You are not required to write these details that I am mentioning, but I'm just giving you an example, using them as an example to what we have mentioned before. I mentioned that some of the bursae communicate, some of them do not communicate with the capsule of the shoulder joint. But you are not required now to know which of these bursae, the name of these bursae that communicate and do not communicate. I'm just using them as an example. Is that okay? Okay. And there are also a lot of muscles, as you can see here, attached to the scapula and surround the shoulder. These are called rotator cuff muscles. Rotator cuff muscles. Because they rotate the humerus and they are attached to the head of the humerus like a cuff. They surround the head of the humerus like the cuff. So that's why they are called rotator cuff muscles, and they are very important for the stability of the shoulder joint. In general, the stability of the joint depends on the shape of the bones, it depends on the ligaments, and it depends on muscles. And each of these three factors plays an important role in one joint and plays less important role in the other joint. So here we can see that there are also ligaments, like the glenohumeral ligaments, coracohumeral ligaments, transversohumeral ligaments, and this joint has a special feature here where there's a tendon of a muscle which passes inside the joint, inside the capsule of the joint. And this is the tendon of the long head of biceps. The biceps muscle is the muscle in the front of the arm. It has two heads, so it's called biceps. If it has three, then it's called triceps. And the muscle here has four heads, so it's called quadriceps. The long head of biceps here, as you can see, it passes within the capsule of the shoulder joint. And you can see also it has a synovial sheath. It is surrounded or wrapped by a synovial sheath to reduce friction. The hip joint, if you compare the hip with the shoulder joint, you will find that there is a very deep socket here. If you compare it with the glenoid, this is the acetabulum. So it's a deep socket, and most of the head of the femur fits into the sockets. So the joint is more stable. This is what we need it for, because we need it to hold the body weight and to maintain the upright posture. So there's always a lot of pressure on this joint. But at the same time, the range of movement that take place at the hip is much less limited if you compare it with the range of movement that take place at the shoulder joint. There is more stability and less mobility of the joint. Again, it has a capsule. It's a synovial joint of the ball and socket variety. It has a capsule, and the capsule is strengthened by extrinsic ligaments, which are thickenings of the capsule. You can see here the pubofemoral, ischiofemoral, and the iliofemoral ligaments. These are very strong ligaments here, and their names are derived from the names of the three bones that form the hip bone. So pubo, ischio, and ilio, and then the other side, they are attached to the femur, so they are all femoral. This is to show you that, remember we mentioned last time about the neck of the femur, which is a narrow part that is distal to the head, and this neck is a very weak point, especially in the elderly, and so when the neck fractures of the neck of the femur are common in elderly women, and when the neck fractures, usually they will replace the entire joint. So you can see here the prosthesis that is used to replace the entire joint. Some other joints in the body can be also replaced with a prosthesis, like a metal prosthesis, like the knee joint, the shoulder joint. They can be also replaced. Another example of a joint is the knee joint. This is the joint between the femur and the tibia, but on one side, and the femur and the patella. Remember the patella, the sesamoid bone in the tendon of quadriceps femoris muscle. So the joint between the tibia and the femur is a hinge joint, and this one is a plane joint, a gliding, allows gliding movement between the tibia and the femur. So the joint allows flexion and extension, and some degree of rotation is allowed during flexion of the joint. As some other synovial joints in the body, there are bursae. I mentioned some of them: suprapatellar, prepatellar, infrapatellar. You can see here that, for example, the prepatellar bursa is located in front of the patella. So the prepatellar bursa is inflamed in people who always work on the floor and rub their necks against the, rub their knees against the floor. And that's why inflammation of this bursa is called housemaid's knee. While there's another bursa here, infrapatellar bursa, which is located in front of the patella, the tuberosity of the patella. That's the bone. You can feel it in the front of the upper part of the patella. It's the bone that we kneel on. So this bursa gets inflamed in people who kneel a lot. That's why inflammation of this bursa results in a clinical condition called clergyman's knee. Again, reminding you that the bursa is a cushion or a pillow that contains synovial fluid and reduces friction. Ligaments are extrinsic ligaments, like the tibial and fibular collateral ligaments, or sometimes called medial and lateral collateral ligaments, and the intracapsular ligaments, like the anterior and posterior cruciate ligaments. And this joint also has another feature, which is the presence of menisci and intra-articular discs of cartilage, fibrocartilage. You can see here these menisci, remember that they will provide a tight or stable articulation between two bones that are not that congruent. You can see here the head of the femur does not fit that much on the tibia, so these will help in making it fit better. The one on the lateral side is C-shaped. The one on the medial side is C-shaped. The one on the lateral side is more or less circular. So they are called menisci, medial and lateral meniscus. These might be injured in knee injuries. The knee is easily injured, especially during contact sports like soccer or football, when there's a hit on the lateral side of a semi-flexed knee, like this one. And this might result in rupture or tear in one of the cruciate ligaments, in the menisci, and in the collateral ligaments in this case. A joint can be examined by an endoscope, which is called arthroscope. So you pass an arthroscope and you can see what is inside the joint. This is specially used for the knee joint because of these frequent sports injuries. So some of these sports injuries are not only diagnosed by arthroscopy, but they can also be treated by an arthroscope. For example, a torn piece of a meniscus can be moved out without the need to open the entire joint. This can be done through the scope. Okay. Joints might be affected by diseases, not necessarily by injuries. They might be affected by diseases like this autoimmune disorder, which is called rheumatoid arthritis. You can see here that the cartilage of the joint is destroyed. This is the metacarpophalangeal joint, a knuckle. And you can see that the cartilage is destroyed and the bones will fuse together and the joint space will disappear. See here, there is a joint space. The joint space is here, but here the cartilage will be attacked by antibodies of the own. It's an autoimmune disease. Antibodies attack the tissues of the own, so they attack the cartilage and destroy the cartilage. So joints might be affected by pathological process or by injuries.